This is a Global News special presentation.
Welcome to our Global News special virtual town hall with Provincial Health Officer Dr. Bonnie Henry and BC Health Minister Adrian Dix. We're doing this once again because we are now approaching 2 years of this pandemic, and so they have graciously agreed to join us to answer your questions tonight.
And we'll let everybody know we're broadcasting on BC1, CKNW Radio, and also on Facebook Live. And we want to thank the hundreds of people who submitted questions. Many covered similar themes, so we hope to get to as many as possible during the next 60 minutes.
All right, so let's get right into those by first talking about the highly contagious new variant, Omicron.
That's right. Joanne from Victoria says that she knows 15 people with COVID who all tested privately and are not part of the official case count. So she wants to know, how accurate can your case count be at this point? Is the hospitalization number specifically now the one to watch?
Yeah, so perhaps I'll start with that one. And the answer is yes, we've been trying to actually move away from the daily case counts for a while. It's one piece of information that helps us understand the trends of what's happening over time. And it is still important. It's important more to look at the 7-day rolling average, and we've been reporting on that for some time, because that's based on our PCR testing. So that is standard and has been the same all along. And that's the one thing that helps us with what we call surveillance, is measuring the same thing over time, and that helps you tell what the trends are. But you're absolutely right, and I've said this in the last number of weeks. When we have a really highly infectious variant like the one like Omicron, it's a whole new game because it spreads very rapidly. So we can't do, it's just not physically possible to do that case and contact tracing like we did before. And so many people are getting infected that we just do not have the capacity, and this is a global problem. We have a certain amount of capacity for lab testing, and ours was about 20,000 PCR tests a day, and we can't go beyond that. It's just not possible. So that's why we have to change our approach to how we're looking at this new variant and how it's spreading in our communities. And all of us have to be proactive. And I think, the experience that this person has in Victoria about knowing that many people, I think that is going to be the common thing. It probably is already for most of us, at least in Victoria, in the Lower Mainland, where we know lots of people now who have this. And it's going to go through very quickly. The one thing we have on our side is that we have a lot of people vaccinated in BC, which means that for most people, it's going to be a very mild illness. But these are all things that are changing right now, and we look at the other things that help us understand the trends that are happening as well. So those daily case counts are really a subset of people who are getting sick. We also have monitoring of hospitalizations. That is really important because that tells us how many people are getting seriously ill, and that's one of the important things we need to watch. We also have wastewater surveillance. We do things like we monitor the percent positivity. We do have an online reporting for people who are using the rapid test where you can report your results. And those are separate, but we do watch that as well. And it gives us another sense of what's happening in different places.
You see the hospitalization numbers. Are you concerned?
Obviously, our healthcare system is very stretched, and I'll let the minister talk to that as well. So any additional burden is very much a challenge right now because we're not only dealing with people needing hospital care, and some of that is still from Delta and some of it's from Omicron, but we're also dealing with healthcare workers who are ill. Thankfully, because they're all vaccinated, most of that is mild illness, but it does put an additional strain on the system. And Minister, I know you've been watching.
That's right, and you know, there's two things we look at. We look at the hospitalization number and those in critical care. And you see what's happening in Quebec and Ontario, where those numbers have gone up more quickly than we have right now. But obviously, we're concerned that we may be some period behind them. But we look at the overall numbers as well, and those we have some control over. So the number of COVID cases in hospitals increased significantly in the last week. And we're dealing with that by reducing where we have the option and it's a difficult choice, non-urgent scheduled surgeries, such that there are fewer people in hospital today than there were on Friday because we have reduced the number of other procedures. But there's a limit to how you can do that. January is typically a very busy time of year. Typically in the pre-COVID period, it would be a time when we'd be over 100% capacity. So we're working on this, and we've been planning on this for weeks. It's why when we made the announcement 2 weeks ago that we were canceling non-urgent elective surgeries or 3 weeks ago now, as of January 4th, that we were planning and preparing for what might come. And so it's a very significant challenge for our healthcare workers, and especially so since, as Dr. Henry said, we have a number of healthcare workers now, a significant number everywhere, long-term care, community care, home care, in public health, and in acute care, who are themselves sick. So that reduces our ability to care for people.
Well, and maybe that sort of starts to answer our next question, which comes from Cody. Cody wants to know, why are we seeing so many more restrictions when this is the mildest variant we've seen? Those are Cody's words. We have talked about how Omicron, we believe, is not as severe as the other variants. But why more restrictions given that Omicron seems to be less severe?
Yeah, and that's these are the things that I started to talk about when we first found out about Omicron. How quickly was it transmitted? What was the incubation period? Were people more likely to have breakthrough infections? Were people more likely to get reinfected? And all of those things are things that we are now learning. And one of the critical ones was severity of illness. So yes, we are now globally and here in BC seeing that the illness from Omicron is not as severe as Delta in particular. So part of that is because so many people have protection from vaccination. But the other part of it, of course, is that it spreads that much more quickly. So even if a very small percentage of people need hospital care, the fact that so many numbers of people are getting sick means that that number of people needing hospital care can be overwhelming to the system. So the restrictions are to do a couple of things. We cannot stop this virus, and we've known that for a long time now, and particularly one that is this infectious and is spreading this rapidly. So we have to try and flatten the curve and spread out the amount of people who need hospital care over time. The other thing that I think is really, really important is this is a different game, as I've said, because of the way it's spreading so quickly and the fact that there are more breakthrough infections. So people who are vaccinated are able to get infected. They mostly have mild illness, but they can spread it to other people. So people who aren't vaccinated, what we are seeing is they do still have that same risk of having more severe illness and needing hospital care. And right now, they don't have that buffer, that protection from infection that the rest of us gave them from being vaccinated. So if you're not vaccinated right now, your risk has gone up a lot of getting infected and having more severe illness and needing hospital care. So you have to take extra precautions.
Shell, one of our viewers, wants to know if there's a way to tell the difference between a common cold or flu or any other malady you may be getting and Omicron. Also, what do you think about N95 masks and their place in helping prevent the exposure and transmission of this virus?
Yeah, so the answer around the first is it's very difficult, and especially people who have milder illness. This Omicron variant attaches more readily to the ACE2 receptors, we call them, in the back of the throat and the nose and the upper airways. So you can have those runny nose, runny eyes, sneezing, but we are also seeing that younger people also get headaches and the muscle aches and feeling tired and run down as well, and cough and all of those other things. But early on, it's very difficult to tell the difference. So that is why, with the testing limitations we have and the way this is moving so quickly, the best thing to do is, if you have those symptoms, stay away from others, and particularly stay away from people who are at risk of having more severe illness. And that's the best thing you can do. We know now as well that this is a shorter duration of illness, especially in people who are vaccinated. They tend to have milder illness illness for a shorter period of time. So if you can, 5 days is the best. And then wearing masks around other people if you have any concerns at all, that's important. Yeah, you know, respirators, N95 masks, they have a very specific and important role in healthcare. And in healthcare, they need to be fit tested so that we know they're providing that adequate barrier. And yes, they are important when you have people who are known to have COVID, and we see them used a lot right now, especially in emerge departments and our ICUs and in COVID wards where we know there are sick people with COVID and there's virus in that environment. Where there's less evidence that they have, that incremental benefit is in those short transactional settings that we have, like going to the grocery store, where you're around people for a small period of time, you can move away, you can keep your distance, and wearing a decent 3-layer mask that fits well to your face, that you're wearing properly, which means over your nose and your chin, and you're breathing through it. The added advantage that you get in those types of a situation from an N95 is probably not worth it for most people. If you are somebody who's immune compromised, or you have other risks, and you're around people where you don't know them, you don't know their vaccine status, you don't know if they're sick or not, then you can make that choice to wear a good quality medical mask. And one of the things that we're seeing is that you can help your medical mask fit better by wearing a cloth mask over it, and it just fits it better to your face, or some of the N95 masks.
Just out of curiosity, what kind of mask do you wear, Dr. Henry?
I wear a nice, good quality 3-layer mask that fits, has a nose piece that fits over my nose, and it fits well to my face and under my chin. So that's the one I use mostly.
Okay, all right. I'm sure we would have seen it during the briefings, but let's move on to another popular topic in our inbox. Today, of course, first day for kids going back to the classroom after an extended holiday break, and we have lots of questions from concerned parents and teachers. So let's start with Virginia. Virginia says Dr. Tam has said schools are a source of transmission, and many infectious disease specialists are saying Omicron may be as infectious as the measles. So given that, when elementary schools have so many unvaccinated and partially vaccinated children, how safe are they? And I'm going to pull a Richard Zussman here and ask a second part. For kids who may only have that one shot or who don't have any shots yet, how long should they isolate if they have COVID or symptoms of COVID?
Okay, so the first one is, I think it's very clear that this is not measles. And we can tell that by the pattern of outbreaks, the patterns of transmission that we're seeing. So it's not measles. Measles is a very highly contagious virus. It lasts in the air for long periods of time. We're not seeing the same types of outbreaks that we see with measles. And yes, there are, we're seeing it transmitted more readily, particularly in those indoor closed settings when you're not wearing masks, and you're with family, when you're doing things together in your social networks and your social gatherings. And obviously we've seen a dramatic increase when schools were not in session here. We also know that you have multiple layers of things in schools that make them as safe as it can possibly be. Obviously, there's no situation in our community anywhere where there's no risk of being exposed to COVID and contracting it yourself. But we know that from all of the experience we've had over the last 2 years, that schools are the lower risk of a lot of different places that we can be. So the things that make it that way are, we screen people out to make sure that there isn't a lot of people with COVID in those environments. We have spent a lot of time and effort around reformulating classrooms, making sure there's ventilation, paying attention to mask wearing, and making it a positive experience for children. I know that's a challenge for some children, and they're doing amazingly at it. And we know that for the vast majority of the exposure events that we've had in classrooms where kids have actually been sick in class or staff have been sick in a classroom, we don't get transmission. We don't get what we see with measles, for example. And we don't expect that to be any different with this. Yes, there are going to be children who get COVID. There are going to be staff who get COVID. The vast majority of them, like healthcare workers, are going to be because we're part of society and we have social networks and we have family and we have people that we're around. And the risk benefits of being in school are just so much more benefit of being in class and managing those risks as best we can. And I know educators are doing that every single day, and my hat's off to them because I know this is so important for our children.
Just the follow-up to that, for children who are not vaccinated or only have one shot so far, what is your guidance on isolating if they have symptoms? Yeah, so, kids tend to have mild symptoms anyway, and there's a whole lot going around. So yes, parents know their kids, and if they have symptoms, keep them at home. And for everybody who's vaccinated, for everybody, we're really looking at that 5-day period. But for children, it can be really mild. And if it's mild and it goes away in 1 or 2 days, then they're fine to go back to school.
All right, we swear we're going to bring the health minister in a moment, but as a
Sorry,
father,
no problem.
Well, yeah, and you'll appreciate You'll appreciate this question too, Adrian, because it involves basketball. As the father of a grade 5er who is desperate to play, we got a question from Bill who asks, will the province be restricting school sports during this time? And I'll add, what's the metric to figure out when those restrictions will end?
Do you want me to start?
The restrictions are, just so everyone understands, the restrictions are provincial health orders that are made by Dr. Henry, and she and her team do an exceptional job working through that and finding that balance. And I can tell you, Chris, and everyone asks this question all the time, like why this area or this restriction. All of them require a lot of thought, and in every case, the consequences of those restrictions, whether they be for a business or for a young person who might be playing their grade 12 basketball tournament in a year or so on and so forth, all of that is considered as well, and I'll throw it over to Dr. Henry.
Yeah, so we have tried from the very beginning, recognizing how important sports and arts and music are for young people in their growth and development and learning. So that has been sort of, same with schools, the last to close and the first to open again. So we don't have any intentions of restricting more so than what's in place now. So yes, right now, we don't want a whole bunch of kids coming together over multiple days and having tournaments. So that's kind of out. But playing games, especially in your local region, absolutely. And that's something we're not going to put any additional restrictions on what we see in schools right now. Those are all parts of the whole learning experience in schools. And the criteria that we're using, really, the things that are in place right now, and I intentionally put shorter expiry dates, if you will, or dates of reassessment on these, because part of it was to learn more about what we're seeing with Omicron, and part of it was to see, how one of the things we are learning is that the peak tends to be higher and it comes down more quickly. So if we start to see that, then as soon as we can, we'll be taking away these restrictions. And right now, we're still on that high up peak. But if we follow trajectories that we're seeing in other parts of the world, we will start to see that coming down very shortly. And so that is one of the things that we'll be watching really carefully. Obviously, the other one is, do we have enough in place that's trying to allow as much as possible to continue and not overwhelm our healthcare system? So right now, I don't foresee doing additional restrictions, and hopefully over the next couple of weeks, we're going to see a real change in the trajectory of what we're seeing right now with Omicron.
Here's hoping. All right, Linda wants to know, how do you justify letting government workers work from home, but not teachers and students? Dr. Henry, Adrian?
There's some government, Minister can talk to this too. I mean, obviously there's some government workers that can't work from home. There's some jobs that require people to to be in person. And we've learned this over this last little while, how many people really are essential for us functioning, whether it's grocery store workers or pharmacies or gas stations, the person who collects garbage. These are all important, essential things that keep us going. So some government workers are able to work remotely. Some of us go into the office every day or other places. And it's the same with school staff and teaching. In classroom learning at all levels is important for not just intellectual growth, but emotional growth, physical growth, our interaction in society, and that is such a critical, important role that educators play, and it is our future. So it is part of how we try and get through this together, is by doing as much as we can to keep those important functions going.
And it should tell us how much we should respect our essential workers as well. I mean, we did put in, as you know, a mandatory vaccination requirement in healthcare, something other provinces didn't do. We did it here in BC. And it wasn't because we don't love and respect our healthcare workers, we do, but because it was necessary because of the circumstances of their jobs. It's necessary in education as much as possible to have in-class learning. And one of the things that we've achieved in BC, and it's not my achievement or the government's achievement, it's our achievement, it's teachers, it's education assistants, it's administrators, it's students themselves and parents and everyone who've made this happen. And the cost of not having that over this pandemic that is now, we're going through second anniversaries, the second anniversary of the first time Dr. Henry and I met on this question was this week. This has had a huge impact. So we make these decisions, and all of those that have to work in person have had to throughout the pandemic. Healthcare workers without change, our first responders without change, our grocery store workers, many people who provide essential links and transportation. It should make us respect them even more for all they have delivered for all of us during the pandemic. So these aren't easy decisions. But of course, and people have made real sacrifices, and we should respect them. But we should also celebrate what we've done together.
Yeah, no doubt. And I think it's mostly universal, right? We are so pleased and thankful for all that essential workers have done. We got a lot of questions about children and the vaccine, probably no surprise. And Christina asks, what is the effectiveness of only one dose in children 5 to 12? What is the efficacy specifically to one dose of the vaccine for children in that age bracket?
Yeah, good question. So we know from the studies that were done that you start to build your immune response and you get a good high level about 3 weeks. But of course, they were given in the studies a second dose at about 3 weeks. So we know that the vaccine effectiveness and the efficacy from the studies are both really high, in the high 90s by the time you're 2 weeks past dose 2. It's very hard to know one dose, but we know that at least one dose gets your immune system primed to look specifically for the spike protein of the virus. And so your immune system has an advance warning, essentially. If you get exposed to the virus, you have those antibodies for the specific part of the virus that binds to the cells. So we know it gives some protection. It's not perfect, and we can see it in adults. The vaccine effectiveness after a single dose is in the 50 to 60% range. We expect it would be similar for children as well. But it is that balance as well. It takes time for your immune system to develop the cell-mediated, the memory part of the immune system. And that's why it's important to give enough time for that to mature before we give the second dose, so that you can get longer and stronger lasting protection. And we've seen that in adults, where we extended the interval to make sure we could get really good protection in most people, and it showed that you get much better, longer lasting protection if you give that immune system more time. And that's why the interval for children is also at 8 weeks.
So that actually might answer our next question.
Okay.
Yes, Golneet wanted to know if you're considering shortening the length of time between the 2 doses for children in order to get more families completely vaccinated. And I gather from your last answer that that would be no.
Yeah. So no, it's a matter of if you give the doses too soon, you just don't give your immune system enough time to really get a good, strong, I call it mature response in the second part. So you develop antibodies, and then when you get the second dose, those antibodies go up again, but they go down over time, and that's the way the immune system works. If we had antibodies in our blood to everything that we've got immunity to, our blood would be sludge. So those proteins they do go down over time. But the cells, your memory cells, your B cells and your T cells, those are the ones that give you long-lasting protection. And it takes time for that to happen. So it really is better to have a little bit longer interval between dose 1 and dose 2. You're going to get good protection. And with every dose, in that first couple of weeks, once you get those antibodies up, you do have really strong protection against infection, that onslaught, because the antibodies are there. And then as they go down over time, and when you get to 8 weeks, you get a nice booster and those antibodies go right back up again.
What about
the one thing I'd say is, it's really critical that children get their first dose, and about 151,000 children have received the first dose so far. About 188,000 have been registered by their parents. There are 349,000 children 5 to 11. So I really encourage people to go on the Get Vaccinated website and register their children. They'll get an invitation to book almost right away, and to get vaccinated. Because we're at about 43% of children vaccinated, about 54% of children registered, and that's very good. We want it to be higher, and really encourage people to do it tonight if they can. Get on the website, register your children tonight.
Excellent advice. What about the age group? Donna wants to know the children under the age of 5. When might the vaccine be made available to those kids under the age of 5 years old?
Yeah, so both Moderna and Pfizer have been doing studies in younger children down to 6 months of age. And before 6 months of age, our immune systems aren't really developed enough to be able to respond to a vaccine. And I will put in a plug that that's why it's so important for pregnant people to be immunized, because you get the protection, and we know that's really important when you're pregnant, but you also give antibodies to the infant, and that protects them in that first few months of life as their own immune system is developing. But when we talk about 6 months to 5 years of age, there's been some challenges. The initial 2-dose vaccine that Pfizer was working on showed that it didn't have as strong protection as what we're seeing in the 5 to 11 and the older children and adults. So they've gone back to the drawing board a little bit. So it's unclear when we're going to have a vaccine for those younger kids, which is all the more reason why it's important for all the rest of us, or people who are around younger children, to get the protection themselves.
Mm-hmm. All right, this next question comes from a concerned grandparent. And I've heard this from a lot of families. They want to know that given children under the age of 5 are not able to be vaccinated yet, and they spend time in settings like daycares, what is the plan to keep them safe? And I guess not just them, but then their families that they live with, because many of these kids live in multi-generational homes.
Yeah, and it really is, as I was saying, both ways. It's us protecting those children, because we know younger children can have more severe illness with COVID, though thankfully for most of them it's still mild. So it is both things. We have, and I do want to also recognize the early childhood educators and our daycare operators, because they also really important to have those safety plans in place, and we've been working with them. We have updated guidelines that came out recently. So the most important thing we can do is all the rest of us be vaccinated. That protects you, that protects them. And so older people in multi-generational families, really important for you to get your booster shot. Get vaccinated, get your booster shot. That's the best we can do. And then if children are sick, making sure that we try and keep them away from those who are most at risk. Keep them a little bit isolated as much as you can, and I know that's a real challenge for young children, but maybe stay away from people who have immune compromising conditions especially.
All right, BC's booster program ramped up earlier this month in an effort to curb the spread of the Omicron variant. A lot of viewers have questions about the program and the booster shot itself, things related to timing, so let's get to those now. Andrea from Chilliwack asks, what's the optimal time to wait after a COVID infection to receive your booster if you're on the list to get a booster?
You know, as soon as you're feeling better. And I've had this question from a number of people, well, why do I need the booster if I've had the infection? It's still, particularly in people who've been vaccinated, mild infection, it may not stimulate a whole bunch of immune response. And it varies depending on how sick you are and everything else with it. So as soon as you're feeling better, go ahead and get your booster dose.
Which, the next question is sort of, again, playing off that, you would definitely say if you have had Omicron, you should get your booster anyways. What does that do to the status of your immunity to have had both?
Yeah, what we are seeing is that people who've had vaccine and infection and then get their booster dose are basically super immune. It really gives you really strong antibody response, but also stimulates those the memory cells again, your cell-mediated immunity. So we think that they are the people who are most protected over time. And what we're really hoping, and one of the reasons, and this is a question I get a lot too, is why are we still waiting for 6 months? Because we know that that extra time really, again, gives you longer lasting protection. Because we're going to be living with COVID in some form or the other for quite a long time. And so we don't want to sacrifice our ability to weather the next wave. So 6 months is still seems like a reasonable time. There's some evidence that even out to 8 months for younger, healthier people probably gives you longer lasting, stronger protection. But in terms of, trying to deal with what we have going on right now, we've moved it up so everybody gets it at 6 months. And that, I believe, will help us get through this wave, but also for what's coming in the future as we learn to live with this virus.
Many people have questions about whether to get Pfizer or Moderna for their booster shot. Should those with Pfizer previously stick with that, or should they switch it up and get Moderna? What's your best advice?
Well, I can tell you I'm a Fifi mod. So,
is that what you call it? Okay, yeah.
I'm learning the lingo. So, you know what? Both are fine, and that's another thing that Canada has been one of the leaders on is learning about mixing and matching of vaccines and how effective that can be. So either one is fine. I will say there is some evidence that Moderna gives a stronger, longer-lasting response. Even the booster dose of Moderna is half of the regular dose, and even that has been shown in some of the studies, very limited in some of the countries that are sort of ahead of us, that Moderna probably is the best, strongest for a booster, but either one is really great. So you don't need to have Pfizer if you've had Pfizer. You don't need to have Moderna if you've had Moderna. Take whichever you've got, and if you have the option of getting Moderna, then go for it.
And I've had Moderna for all three, Chris. So there you are. So I'm
wow.
I'm a
okay, that's you're an anomaly.
You're a Moderna man.
I'm a Moderna man. I don't know. Don't know about that, but I did get Moderna.
Interesting. Okay.
I'm double AZ and Moderna. I don't know what you'd say. What would you call that? I don't know if you can say it on
You're
TV.
an Astra mod.
Astra
mod.
Okay. All right. Dr. Henry, Minister Dix, we've had many questions come to our newsroom about the vaccine and questions about whether there have been adverse reactions in connection with vaccines in this province and whether there have been any deaths linked to the vaccine.
Yes, so absolutely. We have an adverse effects called adverse events following immunization, or we call them AFEs. So it is something that we have a very strong reporting system in Canada, and every province reports it. It's part of an international group that looks at these across the world, which is one of the reasons we know some of the very details about adverse events that can happen after these vaccines. It's also how we picked up some very rare events like the thrombocytic VIT after AstraZeneca. That happens very rarely. So yes, we have had serious adverse events following immunization, and we call it that specifically because there are things that happen after people are immunized that may or may not be related to the vaccine. We've had 4 people in British Columbia who've had VIT after vaccines that have been caused by the vaccines. We've had a very small number of people who've had myocarditis or pericarditis after receiving mRNA vaccine. There's been no deaths associated or directly related to vaccines. We have had, and I was looking at the numbers earlier today, but it's a small number in the single digits of people who have died within 30 days of receiving a vaccine. None of them in investigation have been directly linked to the vaccine itself, but these are things that we follow very carefully. There's a report that's published every 2 weeks on the BC CDC website, and you can see all the details of all of the serious adverse events that have happened.
Just to clarify, though, Dr. Henry, the number of adverse effects compared to the number of people who have been vaccinated in BC is a very, very small percentage.
It's less than 0.5%. Yeah, you're absolutely right. We've had in the vicinity of 400 serious adverse events in almost 10 million vaccine doses given in the province. So yes, these are of the safest vaccines, and the most, one of the things that was really, really important when we started our vaccine program was making sure that we recorded every vaccine that went into everybody's arms. And I know early on there was a lot of, how come it's taking us so long? Why is it taking us so long to get pharmacies on board? It's because we need to get every single dose into our immunization registry so that we can monitor this safety over time, and we know exactly which lot of which vaccine people received, so we can follow up on any signals that happen around safety, and that's been really, really important.
Far more likely to have adverse reactions to COVID than to vaccines. It's become very clear.
By a factor of 10 to 100, just as dramatically more severe illness across the board from being infected with COVID.
There you go. Let's hope that stat sticks. Changes to visitation at long-term care centers prompted a lot of questions to clear up some of the confusion there. We got a question from Brian who says his 90-year-old father in care who asks him daily when he is coming to visit. He's double vaccinated. He's willing to wear an N95 mask, and his question is, were any other options considered before the restrictions on visitation that the province put in?
In fact, all of the options, I'd say, have been used. If you think about it, everyone working in long-term care has to be vaccinated. Everyone visiting in long-term care has to be vaccinated. We put on a very significant response to protect people, and still there have been significant issues in long-term care over time. We, just before the Christmas period, were down to 0 outbreaks in long-term care. Because of the Omicron variant of concern, we now have dozens of outbreaks. And I know this from personal experience from our family, and we're going through it right now, is that when an outbreak occurs, it has very significant effects on everyone in the care home, not just on visitation, but on everything else. So these measures are in place in a short and direct sense that Dr. Henry's put in place in a short and direct sense to address the very significant uncertainty in healthcare and to protect people, residents of long-term care. And I know personally, I want Brian, I think the name of the questioner was, to know that it affects us personally. And we have focused on this and talked to dozens, if not hundreds of people over the last number of years. It is not anybody's intention for these restrictions on visitation to last as they did last year. But this was a necessary step taken to protect people given the significant growth in transmission of the COVID-19, the Omicron variant of concern. And that's what Dr. Henry and that's what all of our teams are trying to do in long-term care.
I will say, it was put in place at a time coming into the long weekend when we still had unrestricted numbers of people that were going into long-term care, and I was getting reports of of a lot of concern of healthcare workers being sick and not having the ability to properly screen people. So we are in a transition now to make sure that we can have that one designated visitor for every resident. It is so important, and we are going to make this as short as possible as this wave comes through here. And as I said, you know, the wave is a lot sharper and steeper, but also moving a lot more quickly this time.
Mm-hmm. All right, Marilyn from Tawasin asks, given the problems of long-term care workers infecting residents, why is rapid testing only being used to screen visitors? And given the outbreaks that we are seeing, despite visitor restrictions, clearly staff are still an issue.
Well, in fact, of course, as you know, we've brought in mandatory vaccination in long-term care. We've been using rapid testing in long-term care throughout last year, 2021, in fact, starting on December 3rd. They've been used in outbreak management. They've been used at different periods in the interim period in advance of the mandatory vaccination order being put in place. And they're being used now since December 21, when we announced the rapid testing plan. 200,000 rapid tests have been distributed to long-term care in that period, long-term care homes in that period as well. So rapid tests have been used in long-term care, they are being used in long-term care, and they will be used in long-term care.
As well as visitors. I'm not sure.
That's right, visitors, yeah, exactly.
All right, Sandy, another question here. She wants to know when all healthcare workers, including dentists, physiotherapists, and massage therapists, would be required to be vaccinated to practice. Is that in the works?
It is in the works, and it's one of those things where we're still working with the colleges about how to make sure we understand the vaccination status of registrants. And so that's in the works, and it will be coming soon. I did put notice in the in one of the orders just before in November about that. It's been more complicated a process than we expected, but it is coming.
All right. Testing has become something of an issue again with the rise of Omicron. So we have a lot of questions about the testing policy in BC. Joan from Trail asks, why is BC making it impossible to get a rapid COVID test? This is what Joan writes. Many people would like access to these tests. As a senior, I would like a test to ensure I do not have the virus as an extra layer of precaution. All right, the rapid test question. It's been one that has come up a number of times.
So I'm going to hand it over to Dr. Henry in a minute. The federal government is getting a significant number of rapid tests. You might have heard the federal health minister, Mr. Duclos, announce they're getting 140 million of them in the coming weeks. They haven't really arrived yet, so we've received in the hundreds of thousands. And when you think about those numbers, so say our number is 18 million, which is about 13% of that 140 million or so is what we would expect to get. 18 million is about 3 per person. So what we've got is the ones we're using in priority areas, such as long-term care, but also we'll be using in education and other areas. And then as we receive more of the rapid tests that can be used at home, because a significant number of them require a medical practitioner to use, a significant number of the ones we have now, then we'll be broadening that out. But when we get them, we'll be distributing them. But what is really important is to take the actions we can take now. And all of those have been what we've been talking about at the beginning, from reducing our social contacts, to washing our hands, to wearing our masks, and to getting vaccinated. But over to you, Dr. Henry.
Yeah, you know, the rapid tests have been a source of angst over a long period of time, and they have evolved. There are many different types of tests, and we've said this a number of times. So the ones that we had here in BC, and in October, we made a decision, I made a tactical decision, that we would wait for the at-home tests that we were expecting to come in November. And they had been delayed, and we are going to start getting some of the at-home tests coming up very soon. But the limited numbers that we had, and they are a limited commodity around the world. So there, unfortunately, we have not ever had enough that we could give them out to people to use as they have in some other countries in Europe, for example. We are hopefully going to be getting a supply that is more regular, that we can then start using them and giving them to people like seniors, so that you can understand the risk around you. And where our focus is at first is going to be at schools for symptomatic children, and to help parents make those decisions about, can my child go to school today? I think it's been unfortunate that they've been billed in some parts of this country and other countries as a ticket to being able to go to social events. And I've said this a number of times. They're very most helpful if they're positive. They're a red light if they're positive, but they're not a green light. And we've seen that repeatedly, because they're just not sensitive enough to say that you can abandon all of those other things that are important. And yeah, I'd love to be able to have more tests available so people can do their own tests if they have symptoms, to help understand your own risk. And we will get to that, I hope, with the tests that are coming in the coming months.
Tom from South Surrey wrote us to ask, he wants to know how reliable rapid tests are, especially with Omicron circulating as it is, maybe specifically for that variant. How accurate are they?
Yeah, that's another one of those pieces of the puzzle that we're learning, and that Omicron affects more the upper airways. And what people are finding is more likely to get false positives and false negatives with this new variant, with the nasal swabs that we're using primarily, and that perhaps throat swabs or saliva might be more accurate for Omicron, where it's the exact opposite for Delta, where we actually had very much better results with having the nasal swabs. So these are all sort of technical things that are being worked out. The bottom, and there's a number of studies that have shown us that there's a lot of both false positives in low prevalence settings, so where there's not a lot of the virus around, and there's a lot of false negatives in some of the higher prevalence. So the bottom line is exactly what I said. If it's positive, it tells you something. If it's negative, it really doesn't tell you anything at all.
And we've had many viewers write in, Dr. Henry and Minister Dix, wanting to know how long you can still test positive on a PCR test even after you've recovered from COVID-19.
Yeah, so the PCR tests are actually very accurate, and they can find pieces of the virus even after you're no longer infectious to others. So it can be a month, 6 weeks. We found that people are still testing positive, although rarely. And generally, it's the cycle time is much higher, which means that there's much less of the virus around. So if it's one of the things that helps us measure if it's an acute infection or if it's something that's just been around for a long time. So it can be for some weeks in some people.
Okay, BC took some additional measures last month aimed at curbing the surge of cases in the province. Many viewers are looking for some clarification, though, and help in planning events, activities in the near future.
Yes, physical fitness was a big one in our email inbox, both of you. So Neil in Vancouver wants to know if gyms are allowed to stay open if they're only operating as one-on-one personal training, and if a trainer and client stick to one pod and don't interact with others, isn't that enough or safe enough to stay open?
So, we try and find that balance of doing the minimum amount of things that are in those higher risk settings. And unfortunately, gyms as a setting are places where we've seen a lot of transmission, particularly in the demographic where we're seeing Omicron cases rising very rapidly. We're now at a different place in that that demographic is now decreasing in terms of transmission and that age group of people who are going to gyms. We have large numbers of our older population boosted now, which means they have increased protection, and the younger age group is now all getting caught up at 6 months with their booster doses. So we're moving into a different place where I've been working with the fitness industry so that we can start to get gyms back open safely again very soon.
Viewers say that because of gyms and the positive impact on their mental and physical well-being, they should be considered an essential service. Is there any thought to maybe changing the categorization of gyms in the future?
Yeah, I just say this about these
essential.
subjects. I think we are, and I think Dr. Henry talked about that. But I would say this, that, you know, the virus doesn't really argue with these definitions. The gym industry, the fitness industry, did an exceptional job after we reopened last year in ensuring that their gyms were safe. Omicron and the nature of its transmission has changed the game and the way the virus interacts with us. So the virus isn't interested in our definitions of things. It's interested in transmitting. And the concern in with gyms and with the fitness industry is that was a place that the virus could transmit and transmit fairly easily. So that's the reason the measures were taken. But again, I can tell you that every time such a step is taken, everybody in public health agonizes over it because it's a very, very difficult call to make that call and to make that decision. We know the impact on people. But gyms are very important. Community centers are very important. Recreation is very important. So the extent we can move on it, we will. But the reason, but I just want to remind everyone that this is not a virus that debates these questions with us. And so sometimes actions have to be taken that are difficult, but have benefits for the whole community and allows us to get through this more easily and better.
A couple of gyms quoted in coverage we had not that long ago, though, that say they've had 160 member check-ins, 70,000 member check-ins, 160,000 member check-ins, and no transmissions in their gyms. What is the evidence you have that shows that gyms are a method of transmission?
You know, I think there's it's very challenging for somebody sometimes to let people know that. We do, as you know, contact tracing, and we have many, many examples where that has been the link between people. But it's, in a sense, it's those environments where we're doing that type of activity that are indoors, that are higher risk, and it is a reality that whether people realize it or not, that is absolutely where we have seen transmissions take place, and then it spreads, and we've shown those, you know, what are they called, the transmission maps where there's a couple of cases here, and you know, somebody works in long-term care, and then it leads to an outbreak in long-term care. So we have seen that repeatedly. And there are many settings that are unfortunately like that. And we've had to take measures, whether it's many of the worship services where we put in restrictions, whether it's nightclubs where the whole reason to be in a nightclub is to be indoors close together dancing with people. And those are environments where this virus just loves it.
Moving on from gyms, weddings. Maggie, who is getting married later this month, congratulations, Maggie, wants to know why she can go to a restaurant to have a meal with 5 other people, but she can't have a table of 6 at her wedding reception.
Yeah, so again, weddings, absolutely. Funerals, those important ceremonies we're trying to protect, but those gatherings right now are the ones, we know that it's not just one table of 6 and everybody stays at their table like in a restaurant right now. And and that's where we're seeing transmission happen really quickly, particularly with this variant.
Valerie wrote in from Vancouver Island. She wants to know why spa and aesthetic services don't require double vaccination and passports at the moment. Any plans to change that?
Yeah, no. You know, there are COVID safety plans in place, and they are working in those environments. I absolutely strongly encourage all owners and operators of spas and personal service settings to make sure that all of their staff are vaccinated. It protects them, it protects your workforce, it protects your workplace, and it protects your business.
We do have a question. We've seen the COVID situation, the restriction situation, Dr. Henry and Minister Dix, across the country sort of vary depending on their situations. Quebec has brought in this policy of implementing a vaccine passport if you want to go to a liquor store or a cannabis store. Is that something you're considering for BC?
Asking for a friend.
Named us.
Do you want to answer that? It's not something, when we put in the BC vaccine card, we looked very much, there was two primary aims. One was, of course, to encourage people who just couldn't be bothered to get vaccinated. And the second really important one was to address those places where you don't have to go, where the risk was higher. So indoor settings where you're doing things like gyms, like sitting close together, like in a theater or another indoor setting. So it really was targeted at those why can't
essential,
I remember the word I'm trying to say?
I think what you mean, like sort of places that are essential to visit, like grocery stores. So you need groceries.
That's right. The intention of the vaccine card really was to deal with things that were not essential, but would lead to transmission, right? And we saw with the Delta variant in particular, its impact on unvaccinated people. We transferred, 120 people in critical care with COVID-19 out of the north in a period in September, October, and November and December, far away from home to get critical care, all of them needing significant help all along the way. So we brought in the BC vaccine card. It has been massively adopted by people in BC. I mean massively. Received not just support, but received support in being downloaded in an extraordinary way. And I want to say that it has been successful, I think, as an instrument because people have adopted it and engaged with it and embraced it. And there are exceptions, and those exceptions sometimes get spoken about, but the BC vaccine card has been effective. But we've also taken tough action that was difficult action in places where jurisdictions like Quebec haven't, like mandatory vaccination in healthcare, which they wanted to do but then didn't do. We've done that, and I think it's serving us well right now.
And the other thing that we considered was the fact that there's alternatives. So, you don't have to go to a movie, you don't have to go to the Canucks game, you can watch things on TV. There's, you can listen to music without going to a theater. So it was where there were alternatives that people could do as well.
I'm just putting it out here, and I'm not advocating for it at all, but Quebec did see a big jump in people registering to get vaccinated when it became clear they were going to need a vaccination card to go to buy those things.
They have priorities.
That's right. As an incentive, maybe it's effective for Quebec.
They've seen them, but I think what's been effective in BC, 92% of people have received their first dose immunization, 90% their second dose. We're closing in on, over 1.2 million people received their booster doses. Is really getting vaccinated because it makes you safer, it makes the ones you love safer, and it makes your community safer. That's a pretty strong reason to get vaccinated. And where we need to, and where we can, and employers can, it's important that they're in many cases insisting on vaccination, as we are, for example, in healthcare and in the public service. But I would say that I think our approach has been very, very successful compared to basically anyone else in the world. And that's because of British Columbians.
Hard to argue that, for sure.
If you can answer these last last questions in 20 seconds each. I should mention, though, that Mark wrote in just Dr. Henry to offer to take you ballroom dancing once this is all over, just so you know. But in 20 seconds each. Oh, do you? Yeah, in 20 seconds each, what are you most looking forward to once this is finally over?
You know what, I think like most people, I really can't wait to travel, and I want to have a good rest.
Yeah.
Mm-hmm. Well, you deserve it.
I think resting would be good. I'd like to see Mark singing and dancing in the rain. I think that would work well.
I'd like to see Keith doing that too.
Dancing.
Maybe they can do a duet.
I like that.
Well,
Dancing
and maybe
with the
we'll do this in
Stars.
person one day.
Yeah, let's hope.
All right.
That would be a pleasure.
That would be nice.
Yeah, absolutely. One day we'll get to it all. Well, thank you so much for being with us once again. I've lost track of how many of these we've done since the pandemic started, but once again, many of our viewers wanted to say how much they appreciate all you do for us and acknowledge how difficult your roles have been over these past 2 years. So thank you.
Thank you very much, Dr. Henry and Adrian Dix. And thanks to everybody watching on BC One and Facebook Live as well. There's a lot, and listening on CKNW. There's a ton of people working behind the scenes to make something like this work, and we appreciate what they do, especially when it comes to monitoring some of the comments we know we get online and through email and all of that. It can be quite traumatic. But thank you so much again to the two of you for your time tonight and for everybody watching at home.
Hey,
Good
thank
night.
you.
Thank you.
Good night, all, and be kind, be calm, and be safe, as Dr. Henry always says.
That's the quote of the century. Thanks, everybody. Have a good night.
This has been a special presentation from Global News.